nursing student with West Coast University, and I'm coming in to conduct your head to toe assessment. Can I have you verify your name and date of birth?
It is Jerry Daniels, April 4th, 92.
Okay, and any drug allergies that I should be aware of before we get started?
No.
Okay, are you experiencing any pain in any places that I should know about?
No.
Okay, I do have a couple of routine questions I need to ask before we get started. They do sound silly, but they are part of the assessment. Can I have you re-verify your first and last name?
Jerry Daniels.
Okay, do you know who the president is?
Joe Biden.
Do you know where you are?
In West Coast University.
And why you're here today?
For a routine checkup.
Okay, and how are you feeling?
Okay.
You're doing well? Alright, well, patient is alert and oriented ×4. Overall demeanor is clean, calm, and collected. I am inspecting his face and it does look symmetric. His skin tone is appropriate for ethnicity. I am going to hand wash and put on my gloves before we go ahead and get started. I'm going to go ahead and inspect his scalp. Check for any lumps, bumps, even hair distribution, or potential infestations. I don't see anything present at this time. I'm going to take my pen light and inspect both of his ears bilaterally. I don't see any drainage, redness, or inflammation present, which is a great sign. Before we did begin the video, we did conduct his vital signs, also conducted his cranial nerve number 2, and assessed his gait and balance. Everything was within normal limits. Go ahead and look up for me, please. I'm going to check the inside of his nose. No signs of nasal polyps present. No septum deviation, and no signs of drainage. Any difficulty breathing that I should be aware of?
No.
And then do you mind covering one of your nostrils for me and breathing out? And then switch for me. Breathing in and breathing out. Perfect. And then go ahead and open your mouth for me. Say ah. All right. It looks like tonsils are +1. Mucous membranes pink and moist. And I would also check his gag reflex at this point as well. What I'm going to go ahead and do is I am going to check his vision really quickly. Upon inspection, his sclera does look within normal limits. Keep your head focused on my pen light and don't move your head. We'll go this way, here, here. Perfect. And then you can just keep your eyes on my pen light and head straight. Beautiful. And then what I'm going to do is flash the light into your eyes one at a time, okay?
Okay.
Perfect. At this point, I was testing cranial nerve 3, 4, and 6. Eyes are equal, round, reactive to light, and they do accommodate. What I'm going to go ahead and do now is I am going to inspect your senses. If you don't mind covering your eyes and covering one of your nostrils and telling me what you smell, please.
Alcohol.
Okay, and then I'm going to go ahead and ask you to switch nostrils and do the same on this side. What do you smell? Okay. Great. Cranial nerve 1 is intact. Again, we did complete cranial nerve number 2, 3, 4, and 6. Go ahead and close your eyes for me. I'm going to test cranial nerve number 5 with this cotton ball. You just let me know when you feel the sensation against your face.
Felt it. Felt it. Felt it.
All right, number 5 of the cranial nerves is intact. Go ahead and smile real big for me. And blow. Beautiful. Cranial nerve 7 intact. Go ahead and stand for me, please. Close your eyes. All right, you can open your eyes and take a seat for me. I'm going to whisper phrases into your ear, or whisper phrases into your ears. You just let me know what you hear, okay?
A, B, C. 1, 2, 3.
All right, testing cranial nerve number 8, which is intact. Also tested cranial nerve 9 and 10 when I was inspecting his mouth. We did have him gag, along with him saying ah. Go ahead and stick out your tongue and move it side to side for me. All right, cranial nerve 12 intact. Shrug your shoulders. And 11 also intact. I'm going to go ahead and have you turn your head one direction for me, checking for JVD, and then move it the other direction for me. All right, I don't see anything present, which is great. I'm going to go ahead and auscultate for bruits in the carotid artery, okay? You can just breathe normal. no signs of roots, just listening to the pulses, which is good. I'm gonna go ahead and feel them one by one bilaterally, specifically the carotid arteries, and they are both +2, which is great. I'm now going to go ahead and actually inspect your lymph nodes before I continue on. I'm gonna go ahead and start right here at the preauricular, postauricular, occipital. And I'm going to come here to the retropharyngeal. Kind of run down your neck here. I'm also checking for a goiter, tracheal deviation. There's nothing present. Working my way down to the supraclavicle lymph node. I was also feeling at that point the deep posterior and anterior cervical chain. Everything within normal limits, nothing was palpable upon inspection. I'm going to go ahead and check his skin turgor, which is going to be a little pinch here, and it looks like he is very hydrated, which is great. What I'm going to go ahead and do now is have a listen to your heart sounds, okay? And you can just read regular for me. We'll start with the aortic, where it's the second intercostal space, right sternum border. S2 is greater than S1. We'll then move over to the pulmonic. S2 is still greater than S1, but this is going to be on the left sternum border at the second intercostal space. We'll move down to the Erb's point, which is still in the left sternal border, third intercostal space. S2 and S1 sounds are equal. We'll then move down to the tricuspid. S1 is now greater than S2, and fourth intercostal space, left sternal border. We'll then move over to the mitral valve, excuse me, where S1 is still greater than S2, and it's going to be the midclavicular line at the fifth intercostal space, and it does sound like everything's within normal limits. I'm now going to auscultate the lung sounds, and you would just breathe in and out regularly for me, okay? These 6 spots anterior. Okay, go ahead and raise your arm for me. I'm going to check laterally. And throughout this process, just a good reminder that my patient's shirt is off, so we can make sure that we're listening to accurate breathing sounds. Everything anteriorly and laterally sounds within normal limits. Go ahead and stand up for me and face this side. Right over here. Checking the back, the spinal cord, no signs of scoliosis. I'm now going to go ahead and auscultate the 8 spots in the back. You just breathe in and out for me. Okay, to check the 8 spots here. Go ahead and take a seat for me. Respiratory is even, unlabored, and within 12 to 20 as far as the vital signs go. Go ahead and open your arms just like that for me, and then close it, and then kind of do this number for me. Do this as well, kind of testing your motor reflexes. I'll then ask for you to do a heel to shin test if you don't mind, each leg. Upper and lower solid bone within normal limits. Upper extremities range of motion rating 5, which is also great. I am checking for temperature on the skin, no signs of edema, and it does feel like he is warm. Capillary refill is less than 2 seconds. His nails are pink and within normal limits. I am going to palpate his arms, his pulses at the radial and brachial pulse. Okay, I am now going to go ahead and check your reflexes. If you don't mind holding your arm out just like that for me. And then I'm going to tap. We'll move to your brachial. And boop. Boop. Bring your radial. Perfect, everything within normal limits there. We did inspection on the posterior and anterior trunk, regular macules, no signs of skin cancer. Also inspecting his arms as well, again, regular macules, skin color appropriate for ethnicity. Go ahead and lie flat for me, please, if you don't mind. At this point, I'm going to go ahead and inspect his abdomen. No signs of distension, minimal rounding, which is normal. I'm now going to auscultate the 4 quadrants, starting at the right lower quadrant. Listening 1 minute each. Again, this shirt would be off. I'm now at the right upper, moving to the left upper, followed by the left lower. Hypoactive sounds, which was within normal limits. I am now going to listen to the vascular sounds. Also sounds normal as well. I did forget to mention, but your symmetry on your upper chest and your respiratory configuration was also normal as well. In just a moment, I'll check your respiratory expansion. I am now going to palpate on the 4 quadrants, pressing light and then deep. You let me know if you feel anything painful, okay?
Okay.
Anything?
No.
I'm now going to percuss. Anything there?
No.
Okay. I am now, how is your bowel movement and your urine been lately? Any foul smell, weird colors going on?
No.
Okay, great. I'm now going to inspect the lower extremities for edema or varicose insufficiencies or deficiencies, and nothing seems to be present. And temperature is also warm, which is normal. I am now going to check the capillaries, which are less than 2 bilaterally. Nails have a pink, even undertone, which is normal. I'm going to palpate the dorsal pelvis for 1 full minute, followed by the lateral tibialis, and that's also great as well. Again, no signs of edema on the upper and lower extremities. They would both be considered a 0 upon inspection. And then go ahead and sit for me, please, if you don't mind. A couple of things I need to do. I'm going to check your deep tendon reflex, and boop, beautiful. And then what I'm going to have you do is point your toes, and the other one as well. Okay, you can point them towards you, perfect, and then kind of invert them inward and outward. Okay, perfect. Range of motion to the lower extremities, 5 out of 5, which is within normal limits. One last thing, go ahead and stand up for me. I can't remember if I did this part, but I'm going to do it again anyways. Breathe in and breathe out. All right, respiratory expansion is normal as well. All right, well, I think we did complete our head to toe assessment. Any questions for me? Okay.
Not at all.
Okay, thank you. We'll hand wash and provide patient privacy.